Thank you for joining me. Today is kind of a special session. There. I'm just going to hop over to Facebook land. For those of you that are joining me today, I haven't done an awareness session in some time. Today we're talking about juvenile arthritis, and I kept tying my tongue with diabetes, and there's a lot of different pediatric, childhood, adolescent conditions. And for the same reasons that you would want to alleviate perhaps symptoms that you're managing with, the same reason a lot of our littles and our kids right up to our teenagers can take advantage of some of the tools you may already have at home. Or I hope to give you some ideas with my suggestions today. Whenever I'm doing awareness sessions, there just seems to be, because I've been with Lifepro some time now, there just is so many more tools every time I do this. Hang on 2 secs here. No. Okay. So there's a little bit of a delay on your end. If you are joining me today, I'm going to invite some questions towards the end of the session. So if you do have a question or you'd like to comment, please make sure that you are on the Lifepro main page, not the VIP group. I've just shared it there, but the comments through the stream on my end are coming right out of the Lifepro main page. So if you'd like to comment, make sure you're on their main Lifepro fitness page. And I'm seeing eyeballs starting to ping, so I know some of you are starting to join me here. If you are joining me, somebody please let me know if you can see and hear me on the other end, and I'll get going on with my ramble here today. I've got a few things I'm kind of excited to talk about. I always try to make these notes before I go live and just have everything simply stuck there for me. But no, I did 3 pages today. I got old eyes and I need to be able to read them. But I see more of you logging in now. Great. So if someone could just let me know that they can see and hear me on the other end, I would be happy to get rambling here. My apologies for the couple second delay in starting there. 2 secs. If you're not joining me on Lifepro's main page, not the VIP page, I won't see your comments coming through on this end. So if you're typing away and I'm not responding, there is about a 20-second delay from the time that something comes out of my mouth to you seeing it on your end. Same with comments coming back, but make sure you're on Lifepro's main fitness page if you want to make a comment, regardless of where you may be seeing me. Regardless, I'm going to get rambling here. Today is about juvenile arthritis, and for, as I said, a lot of the reasons that you may be using Lifepro tools to manage the symptoms of arthritis. Your littles can benefit from this as well. Today's session is a little bit more near and dear to my heart than past sessions when I'm dealing with general public, because I have a large pediatric group that's catering more so to cerebral palsy related conditions. So dealing with lots of mobility, lots of pain, lots of swelling, lots of inflammation, lots of recovering from surgeries. So it's not uncommon, like us as adults, if you are dealing with something, an illness, a chronic illness, there may be a couple of things that you're dealing with. Juvenile arthritis used to be called juvenile rheumatoid arthritis. So for any of you dealing with rheumatoid arthritis, you're very well aware of those telltale signs: the swelling, the inflammation, the pain, and the way that you approach activities and therapies would essentially be the same. We're just dealing with a smaller body. So anything from vibration plates to red lights to guns, there's a lot of things I want to kind of talk about high level, which device may be suitable for your personal situation, is where things get a little complicated, just like exercise. So the severity, if you are dealing with juvenile arthritis, symptoms are all over the map. You know what we might just think is joint pain, or a little bit of swelling after a soccer game, may be a sign that there's more going on. Estimates in the US right now is that I broke the math down a little further. It was 305 in 100,000 will have this excessive joint pain, redness, and sometimes it's not growing pains. Sometimes it's not just sport. It could be juvenile arthritis. So symptoms are going to be very similar as they are to just plain old arthritis. We've got joint pain, as I said, swelling, stiffness of the joints. Primarily when it is presenting, or if you suspect your child has, it really affects a few different joints differently, but primarily you'll see it, the younger they are, it's going to be the ankles and the knees. You also do see it in the wrists very commonly, but as they're younger, before they get into adolescence, it's really common, inflammation, persistent swelling. If you're noticing these things during activity, excessive walks, during the activity, after the activity, these could be signs there's more going on. And it may affect one or multiple joints. I think the average, when I was reading and snooping through Chat GPT, getting prepared, was typically as this disease progresses, just like rheumatoid arthritis says, it can be a progressive thing where it's on and it's off. So, sometimes people go into complete remission as they grow into adulthood. Sometimes, you find your gig and you're managing symptoms and things seem to be okay. And, it surfaces again later on as an adult. So if you are using any of the tools I'm about to discuss today to manage, whether it's arthritis or juvenile arthritis, don't stop using them because things have improved. Always think about that preventative piece, and especially if there's hereditary or, some family history of these types of conditions. So treatment, as I was looking, says, of course, and this is a common sense thing, but focus on that pain, inflammation management, preventing joint damage. Maybe it's a matter of warming things up. Maybe your therapist, if you are dealing with this condition, has given you exercises and stretches they want you doing regularly. A lot of us that have worked with a PT or gone through, any kind of rehab, whether you're dealing with a chronic issue or a post-surgery situation, usually there's a set of home exercises that you're supposed to be doing. Supposed to be doing is the operative phrase there. So what I like about things like vibration plates and infrared saunas and red light tools is they're kind of a hack. They're a way to assist your body, perhaps in reducing the amount of time you're doing an exercise, or maybe if the exercise and the stretching and the therapy is too painful, there's things that you can do to spot treat those areas of your body where those symptoms are presenting before you do the exercise, before you do the things, if that makes sense. And of course, just maintaining all over physical function. Anything that you can do to keep your body, less stiff, less swollen. Make sure you're giving it good complementary nutrition and hydration and rest and all those common sense things we talk about. Is not a per condition thing. These are just good health habits to get into, especially to work on the preventative piece, or if you suspect you may be dealing with these type things. And as I said, some outgrow it. It can come and go. They refer to it as, maybe you're going through a remission period. Some of the folks I deal with, they're doing their activities, the lifestyle improves, or they have better access to therapy and things are great for a long time. And then you take up a new sport, or, you get passive in doing your things that you're supposed to be doing, and symptoms resurface. So keep that preventative piece going. And as I said, it used to be referred to as juvenile rheumatoid arthritis. So the definition has broadened some. So let's talk a bit first about my favorite tool, as always, vibration plate. I've got a new itty bitty here today because we're targeting and talking about the younger audience today. I just want to make sure everybody's here. If you are joining me, please, I invite you to make a comment, just a thumbs up or something to let me know that you can hear my ramblings on the other end. So for the same reasons that being active or exercising is beneficial for us, it's going to be beneficial for your child or your adolescent if they're dealing with rheumatoid arthritis. Regardless of what their condition may be, living an active lifestyle is going to help you, in your longevity, your sports, your sleep, your digestion, all kinds of different things. We know this. So if you are dealing with the symptoms, or you've got a diagnosis and your child is dealing with juvenile arthritis, some of the big benefits that activity is going to give you is of course, it's known to decrease pain. It's going to keep strength there or improve it if that's what you're looking for. Bone density along with that, weight bearing activity in particular. It's going to keep your function strong and better. Like I say, all the same reasons as us, that cardiac health, keeping the bones strong. Some of these fall into short and long-term benefits. If your child is dealing with pain, inflammation, lots of swelling, don't worry about the exercise and the muscle building stuff. Treat symptoms. So I guess why a vibration plate is, of course, my favorite tool is it's equally effective as a symptom management tool as well as an exercise tool, regardless of what you're trying to deal with. Thank you, Bonnie, for saying hello, or Donna. My eyesight, I got to step up to some better readers, Donna. Thank you, Donna, for saying hello. I'm assuming you can see and hear me on the other end. People would be letting me know by now. So the thing you got to think about on the vibration plate, like all the bazillion questions we get every day in the VIP group and on the YouTube posts, it's not so much a how long or what setting or what type of machine is best for juvenile arthritis. No, it's looking at your own personal situation and tailoring the activities or the symptom management to what you're trying to target in your own situation. So I've got the new, oh my goodness, the new VibraPulse. And the reason I'm using this today is if you are dealing with a pediatric user, they tend to be littler. For adults, I love this as a passive feel-good symptom management tool, but I wouldn't call this a workout machine. It's light, it's portable, and if you are dealing with an official diagnosis, 9 times out of 10, once you start using your vibration plate for your symptoms, you're going to want to use it all the time. So it's also a great portable model, travel model. Maybe you're taking it to therapy. Maybe you're taking it to the cabin on the weekend. It's one of those things that not only does it offer very, very immediate relief with some passive exercise benefits, kids love them. It's pretty rare that I've had a kid on a machine that did not like it. But I want to make sure you introduce them to the experience differently than you may yourself. Everybody notices I'm sitting on a stool. Before you even think about structure or what moves you should be doing, just get your child used to how it moves. And I would suggest, because you're dealing with a littler body, we don't want a wide position when we're dealing with anything chronic. When we're looking at symptoms, think of wide as more impact. It's running on most machines as a marker. So if you're dealing with a 2 to 3 year old child that's got inflammation and joint pain, you want to reduce the intensity. You want to reduce the amount of impact. And I guarantee you and your child are by far more going to enjoy a little bit of a faster speed. The slow speeds are very choppy. They're very destabilizing. They're very jarring. And when you're dealing with pain, jarring is not the first adjective that comes to mind. So bring the feet very close to the center. Work with a bit of a faster speed, and just let them figure it out. How, what feels good to them? What do they like? What don't they like? Let them tell you what their experience is feeling like. The best parents out there that can support their children, the best examples of coaches at home are my parents that are using plates themselves. You know how it feels when you put your feet wide. You know what happens when you come up on your toes. You know how to stretch the calves. So anything that you are supposed to be doing as a stretch, as an exercise, a vibration plate, think of it more as an environment that allows the positions you're doing on it to be more effective in less time. And for those of you that are dealing with perhaps a severe chronic condition, if the arthritis is so severe you're unable to bear weight, you can start in a seated position and really just use it as symptoms present. Think of it less as a 10 minutes, 3 times a week thing. 2 to 3 minutes starting out. You can do more later. The number one thing that everybody does, especially with children, is they overdo it. Everybody forgets that a vibration machine is this hack. It reduces exercise time. You get more done in less time. Yet everybody says, oh, I only did 10 minutes. Oh, I only did 15 minutes. Well, that's the max run time. How is that starting? Okay. So my therapists, my doctors out there, I have daily conversations about, oh my goodness, I spooked this kid or I spooked this elderly person. 2 things we're doing wrong with vibration plates for chronic issues: too wide and too long. And if you're able, bend the knees just slightly. If you're not able to bend the knees just slightly, you're fearful in any way, you're dealing with very severe conditions or symptoms, start seated. Get a feel for it before you progress to functional exercise. Give your body a day or 2 just to get used to it. The other caution is there's a huge surge in circulation and lymphatic movement. There's things when you're using a vibration plate that I call forever or ongoing benefits, things that happen every time you're using it. To what degree depends on how you're using it. But circulation and lymph are turbo boosted on this. So juvenile arthritis, formerly rheumatoid arthritis, it's an autoimmune condition. So you probably got some lymphatic issues going on. Let's not overdo it first time out. I know it feels good. I know the kids love making the fancy voice sounds, but do it a couple times, or 3 times in smaller, more digestible pieces, and give the body assistance in moving that lymph and circulation versus trying to blast it when it doesn't have the capacity. So for those of you in particular that are dealing with swelling and inflammation, if you do have swelling, as I said, it primarily presents early on in the ankles and the knees. Don't be surprised if you see more swelling represented further up the body. If the lymphatic system is deficient, it may not have the ability to dissipate all the action. So just be conservative on the time. The worst that's going to happen on a vibration plate if you are dealing with anything chronic is the same thing that would happen with any activity if you overdid it. You're probably going to be a little sore and a little tired the next day. So lesson learned, but don't avoid the plate. Give it another 2-3 minutes because it has huge recovery capacity. So where a vibration plate is also awesome for those of you dealing with rheumatoid arthritis or our littles that are dealing with this condition, I'm not saying don't play sports. If you're an active child or you're seeking to be active, use this as a warm-up tool, 2 to 3 minutes. Less is always more and more often. So hit it for a couple minutes before you go to the baseball field. Use it for a couple of minutes after you came from the trampoline park. You want to minimize things that are going to deteriorate the joint if you are dealing with this condition. A vibration plate is a low impact tool that can be your symptom management tool. It can also be your exercise tool. So I just wanted to touch on that. The reason I also love this new little model for my parents out there, if you are supporting your children and you're dealing with special needs and this joint pain thing, you're physically assisting your child in a lot of ways. So I want the equipment to be manageable. If this is something that you already have in your home, in a perfect world, you would also be using it. The stronger I can keep you, my moms and my dads and my therapists and my caretakers, the more you can keep helping the littles. So long term, yes, of course, you should have a machine with some weight, an adequate machine that you can progress with. Because if I do a really good job at nagging you and you stick with this consistently, you will progress and you're going to want to do more on this, not only because it makes you feel better, but it makes your activities also better. So nothing saying you can't be an athlete when you're dealing with these conditions. This is just a tool to complement the activity. So moving on, type of things you want to focus on, particularly with juvenile arthritis. As I mentioned, low impact sports are absolutely fine, but you may want to have a discussion with your doctor about, am I okay to be playing football or soccer? It's not often, it's not always a yes or no answer. They may just say, well, yeah, that's okay, but you need to do some strength training as well, or you need to do some stretching, or, usually there's other activities recommended to complement the type of sports and the type of muscles you're engaging in those sports. So strengthening exercises in general. I don't care if you're playing sports or you're just a computer kid. Strengthening exercises are key, and that's one thing a vibration plate is excellent at helping you with. Lifepro also has some awesome weights and other tools that you can use. Range of motion exercise. So because of the stiff joints, the inflammation, all those things that come with arthritis, we can get stiff, especially if we're inactive, sitting in that school desk 8 hours a day. Use this a little bit before you leave the house, or before you get home, or before you sit on the couch. There's signs that the body will give you, and when you feel stiff and sore, or the range of motion or the stability is lacking, hit your machine for a minute or two. Think symptom management. Any activities that you can think of to improve your function. So, if your issue is picking up things off the ground, maybe you're practicing picking things up off the ground. If you've got a weakness on one side and you're trying to strengthen it, maybe you're working just one side, maybe just doing weight shifts. If balance is a concern, I added a ladder to my wall today. I pull this thing out all the time. But essentially, IKEA used to sell these. I'm not sure where you can get them. I made this at Adele from the hardware store. But you can use the back of a chair. If you're working with a child that's got pain, fear, not really stable, deals with fatigue, you want to give them something to hang on to, especially if you're using a little plate. So why I like ladders is, now I'm standing here and I'm feeling good. Okay, Debbie, let's try a little squat. Okay, so now I can come down and I got something to hang on to, but okay, now I feel like I need a break, right? And it kind of gives you a visual to focus on versus just looking at a wall. I've had moms hang like iPads and watch movies and do things like that. It's just a good tool if you are pushing yourself, trying to do exercises. You may want to set it up, by the edge of a kitchen counter, something where you can put some fingertips on it just to give you a little bit more support and stability. I was talking earlier about forever benefits. One of the forever benefits of using especially oscillating movement with my littles, that's my only movement that I recommend if you're looking at this technology to start with. But it gives you the balance, like right now. So a lot of my therapists will use a vibration plate for like 30 seconds to a minute. They'll hit it before you go in to do your other things because it makes you more stable. So sometimes you're using it for singular purpose. Sorry, I'm looking there and I'm turning around and things are backwards in my brain. So other tools, let's move on. I'm not going to get into a ton more demonstration on the vibration plate, but I do want to suggest a couple of tools if you are looking or using a vibration plate now. A step is a really awesome addition. This is the Aeroflex that Lifepro retails. It's almost about the same size as the plate that I'm using now, but the height is sufficient with all other plates. A great way to use your vibration plate is to massage the ankles, the back of the knees, those type of things directly. You can do that on the plate, but it's nice to have something that's the same height as the plate. You can massage the calves. You're really only limited by your range of motion. To hit the knees and the ankles, one of the things I love to add is a pool noodle. This is just a chunk that I have cut the width of my plate. And then while you're massaging, you can target those Achilles directly. You can bring it up under the back of the knees. If the inflammation and the swelling is on the top of the foot, on top of the ankle, bring this a little closer. You can kneel on it. Okay, so I kneel on it, but you can just sort of hit the back of the ankles this way. You can sit on the foot. It really depends on what your range of motion is. And again, I'm working with a fairly small plate. The more area you have to work with when you're massaging, really the more luxurious it is. But I just wanted to show you a couple of examples. But if you are looking at using the plate for direct massage features, a pool noodle and the Aeroflex step are awesome, awesome tools to work in addition to your vibration plate. So let's move on to other therapies. So the reason I kind of rambled a little bit more on the vibration plate is there's more that you can do with it if you're looking at a singular tool. It's going to give you the exercise, and you can use it for the symptom management. It's just different in your approach and how you're using it. So again, and just telltale signs if for some reason during an activity, during your vibration plate use, after you're particularly sore, those are indications that you've maybe taken on a little bit more than you're ready for. Just reduce intensity. If you're a parent curious about this condition, those tend to be signs where it's not always just growing pains. As I said, it more commonly affects the knees, the ankles, and the wrist. Most commonly affects the knees and the ankles in those younger age groups. Something else you may want to consider is some protective braces or some sleeves, just to give that joint a little bit of support. So we talked about the plate. Let's move on to red light. Red light. Here, let's do this for full effect. Ta-da! Where's my power button? Okay. Ooh, isn't that fancy? Oh, I don't want to blind you on camera. Okay. So I've got the little BioHeal panel set up today. And one thing that I have learned over years working with my kiddies, they like the plates. There's action going on. They can see what's happening. Red light, depending on the type of red light. So red light is going to be awesome, of course, to address that pain piece that we talked about. Reducing pain is absolutely the biggest priority. It's also going to help with the inflammation. We know it accelerates healing, wound healing in particular. But did you know that it improves joint function? Well, if we're dealing with arthritis and we know we got ankle and knee problems, why couldn't we add some red light action to our vibration plate use? Or why couldn't we use some red light while we're sitting on the couch? So red light is a really good passive way to target that joint health specifically. We know there's a ton of benefits associated with it. We've done, between Amber, myself, and Roseanne, we've done a bazillion red light talks, but it's not something we always think about for our kids. So if you are looking at targeting the ankles, the knees, selecting the right or the best red light tool is really going to depend on a couple things I always want you to think about. Do you want something that's going to be 3 to 5 minutes and something you can put in your pocket and just hit, troublesome spots? Or are you looking more for a tool body experience? Is this something you're adding into your little self-care corner in your regime at home? So there's all kinds of different red light and infrared. Infrared is going to heal the tissue. It's going to improve your mobility overall. That warmth is just so awesome. It also, of course, reduces pain, but it's going to also aid in, additional detoxification, relaxation, just all that stuff. So a lot of Lifepro's tools have red light and or infrared. So these are things to think about. If you're looking at treating a larger area, if it's affecting more, maybe it's affecting both the knees, maybe something like the Aleva red belt might be more ideal, because then you can wrap both the knees, both the ankles, and mama can do the back and the shoulders when she's done. Maybe it's just one hand that's driving you nuts, or it's driving you crazy. I haven't brought this one out in a long time. I've actually had it on loan with an elderly client. Compression is a really great way to not only help with the recovery of whatever, circulation and lymphatic boost, but this has got that soothing infrared heat as well, and you can get up to the wrist particularly. So as I said, the wrist is a common area of concern with this. So this is a really affordable, set it, forget it, watch TV, do nothing kind of tool. That you can charge, and it's also an on-the-go tool. So again, think about what area you're trying to specifically target. Sometimes putting a little thought into how am I going to be using this and where helps you decide which is the best tool. It's not that this one's better or this one has more lights. It's really more about what do you picture yourself using regularly. And if it's for your child, I suggest you select something that they can self-administer. If you want them using it regularly, make it something they can operate or find a little bit cool themselves. Some kids, as much as I love the panels and the bigger blankets and those types of things, kids not so much. They like buttons to push and things like that. So keep that in mind as well. One last thing I want to touch on, which I also don't talk about enough, is massage guns. So massage guns it's hard to put this into a category. So we've got the red light, we've got the infrared, we've got the vibration plate. So the massage gun falls into kind of that relaxation. But a lot of people, when you're dealing with like inflammation and pain, on a kid, you probably wouldn't jump to a massage gun as your first go-to. But here's why I want you to consider it. Kids think they're cool, especially the boys. One of the things I deal with a lot of my little kids, some of them are dealing with juvenile arthritis, but many of them are dealing with neurological issues, muscular disorders, and hand strength is not what they would like it to be. So if you're dealing with special needs and you've got mobility concerns, it's hard enough, when you're just out of shape to condition upper body, let alone when you're dealing with a chronic condition. So with massage guns, for both my care providers and for my littles, it's an awesome way to relieve pain in the hands, the wrist, while developing strength. How now, Debbie? Well, just by hanging onto the gun, and again, just like everything, I want you to crank it up. So I've got the Sonic here. I'm bringing it up to like a mid-speed because all I'm going to do is hang on to it on the couch, 5-10 minutes. Maybe I lay my wrist on it, or maybe, I lay it on my wrist, play around with it. But just the resonance vibration that the gun itself creates is a very, it's a very mild entry point until you can progress to other things where maybe you're using this to help with the knee or the ankle. And you can use this, however you like. You can lay it on the knees as well. Again, you're not, a lot of people think there's only one way to use a massage gun, and that's drilling it in with as much possible pressure as possible. Not necessarily. A lot of my seniors that are dealing with grip strength as well, this isn't just my pediatrics, they got frozen shoulder and they got degenerative disc and all these other things. And, just hanging on to it is a very soothing, very mild. It's quiet. It's not going to interrupt the television program. And it's just a really simple starting point. And I think once you sort of fall in love with the benefits it offers, this is good for Raynaud's, neuropathy. Think of it kind of like, a pocket-sized vibration plate, but it's just pulsation, if you know what I mean. Hanging on to it with both hands, it's just a really great way to get that lymphatic circulation going, address the pain, reduce the inflammation, the swelling, and we can progress from there. Just ways we don't even think about it. So I'm going to put that back down. What else can I tell you outside of my massage gun? So circling back, the biggest thing that you have to look at when you're dealing with a condition like juvenile arthritis is first of all, just start paying attention to the signs. As I said, 3 in 10,000 will deal with this. If your child is showing signs of, excessive joint pain, swelling, even a little redness on the skin surface, ankles, knees, wrists, it can present anywhere, but those are some of the more common ones. Absolutely, maybe there's a sign something more is going on. And kids usually don't complain when they're doing activities that they love. So if your kid's starting to mention, Mom, my ankle's really bugging me, or my wrist is always bugging me when I play badminton, or maybe it's just something to pursue further with your doctor next appointment. And you can live a completely absolute normal life, but proper treatment and early recognition of these types of conditions is really key, so that you can make sure that you're not perhaps doing things that may deteriorate the joint prematurely. So there's always a way to recover and build back up from these situations, but like anything else, prevention and early diagnosis is really key. So pay attention to those signs. It's not a super rare condition, and I do find with juvenile arthritis, it is a co-condition with a lot of my kids that are dealing with spina bifida, scoliosis, MS, fibro, you name it. There's all kinds of things that our kids deal with as well. Plus, they're going through all the hormonal growth and growing pains. And so pay attention to the signs. And for many of the reasons, those of you that are dealing with arthritis now are using vibration plates, are using red light, or are using massage guns, your kids can absolutely benefit in the same fashion, whether they're dealing with a chronic condition or maybe they're just a sporto and need a little warm up and recovery action. So think outside the box. If you are dealing with anything specific and your doctor or care provider is not aware, always have a discussion with them first. Generally about activity for sure, but any therapies you may be considering. And if they're not well versed in some of these technologies, certain vibration plate, anything to do with the red lights and the infrared, I've been supporting littles for quite some time. And sometimes I have a few tips, and it's always about how you start, and the body that you're dealing with will progress differently than everyone. So know your own limits and be conservative on your time and your intensity starting out on any of these tools. Use them more often as those symptoms present and you know that they need attention. So let's see if anybody actually has questions for me or if I've rambled everyone to sleep. So again, hello, Donna. Thank you for joining me. If you are joining me and you have a question for me, please make sure that you are on the main Lifepro page, not the VIP group. Any comments in the shares, when it's a private group, it can't be where it's being streamed to. So it's always streamed to the main page. And if you did have a question or comment for me, please just hop over to the main Lifepro page, and I will see it about 20 seconds after you ask it. Think outside the box. If you had any specific questions, perhaps you're a therapist, dealing with this type of an audience and you had questions, please never hesitate to reach out to myself directly. If you're watching this on a recorded basis, same goes. If I've rambled over a question or you meant to ask something and weren't able to join me live, please just always tag me at Debby with a Y. I don't always get the likes and the shares and the comments, but if you tag me, I definitely will get a notification, and I'll do my very best to get an answer to you, usually within a day. I'm usually pretty good. As I said, every year, I do lots of different awareness sessions because I do support a lot of chronic issues. And every year there's just more and more in the Lifepro arsenal of tools. There's never one perfect tool for every application. But again, when you're dealing with arthritis, and I don't like talking labels so much, but anything that's pain and inflammation, short term, you want to make sure that you're thinking about your tools as a symptom management tool. And as things improve with consistent use, they generally do, stick with it. Keep that maintenance piece going. This is a yin and yang kind of condition, and sometimes things can go into remission for weeks, months, even years. So keep those good habits going if they manage to improve your symptoms, certainly as a preventative piece. And of course, activity and self-care is really critical when you're dealing with conditions like this. We tend to lean on the physical pain, but there is the mental health side of this. It can be it's awful when you're a kid if things are hurting and you can't take care, you can't go play with your buddies, or in some cases even ride your bike because you're dealing with chronic symptoms. So there's lots of ways that you can use these to alleviate those and manage them and live a completely regular life. There's no reason to not. And if you did have questions about dosage, if you're coming from a medical perspective, how long, if you're dealing with other things that perhaps medications that make you photosensitive, sometimes there's other things to think about. So never hesitate to reach out with those questions. Thank you, Donna, for joining me. For the rest of you, I look forward to seeing you next week. If I don't have any questions, I've either talked you to sleep or perhaps this is just some new information and you're still absorbing. Some pretty good deals online with Lifepro, 30% off if you want to hop over to their website and see what some of the deals are. If you're considering, the new VibraPulse is in stock with Lifepro directly, not with Amazon at the time. And I believe all of the other amazing items, part of the reason I selected them today is they were in stock. So if you have any questions specifically, whether it's about items in today's protocols I've talked about, or just other questions that are related, reach out. I'm happy to help you out. Thank you so much for joining me today. Don't work too hard and enjoy the rest of your week. I'll see you guys again, probably next Tuesday evening. Thanks so much for joining me.